As people begin to leave their homes and move about more freely, some people may be experiencing additional anxiety and frustration regarding a possible second wave of COVID-19. These feelings are important to address as they can impact overall well-being and the ability to continue to cope in these difficult times. Having a clear understanding of how anxiety works in our lives can improve our ability to confront negative patterns that may begin during tough times. My name is Danielle Besuden. I am a clinical social worker and work as a manager of clinical quality at Cohen Veterans Network. Today we are going to talk about anxiety and how our brains can begin to create cycles of anxiety that are difficult to end. Anxiety is our brain's way of protecting us from danger and situations where we can be harmed both physically and emotionally. However, when anxiety becomes overwhelming in situations that are safe, we must address it. According to the National Institutes of Mental Health, an estimated 31.1% of U.S. adults will experience an anxiety disorder at some point in their lives. This means that the feelings of worry, nervousness, and apprehension have begun to interfere with their ability to cope. In ending the cycle of anxiety, we learn how to teach our brains what situations are safe and how to handle those situations where we're not. Anxiety can present in different ways for different people. People experience anxiety both physically and cognitively. In other words, we feel anxiety through both our bodies and our thoughts. Physically, we can feel a sense of dread or foreboding, a rapid heartbeat, nausea, or just shakiness. And the cognitive response refers to the anxious thoughts that we can have when we're feeling anxious. These are things like, I can't do this is really dangerous, I can't feel safe, it's not going to be okay. The cycle of anxiety works this way. First, you experience a situation that produces anxiety. This could be public speaking, social situations, or any stressor that brings about anxious thoughts or feelings. In this moment, we can choose to avoid the stressor or to face it head on. When we avoid the stressor, we experience a reduction in our symptoms. Our heart stops beating so quickly, our hands get less sweaty, and it's easier to breathe. When we then feel good about our decision to avoid the stressor. However, the next time we encounter a similar stressor, it is even more difficult to face head on. This is how anxiety grows. The cycle of anxiety works to reinforce the fear and negative emotions associated with the stressor, and it becomes increasingly difficult to face. However, we can end the cycle. As we take steps away from avoidance and towards action, we can begin to feel more confident in our own abilities. Below are some questions that you can ask yourself to determine the next steps. Is my worry real or imagined? It's important to make sure that we are not agonizing about negative possibilities that are not currently present. Is this worry something that I have control over? If it is, then you can fix it. This is the time to end the problem going forward. If not, the anxiety is not productive, and it's important to use coping skills to manage the negative feelings. This can include deep breathing, talking to trusted friends or family members, meditation, exercise, or any activity that works to stop the onslaught of negative thoughts and feelings. Number 3, what can I complete today? Thinking about solutions to other problems in your life or ongoing issues can help reduce your overall anxiety. Number 4, get help. Sometimes we need assistance to reduce anxiety. Therapists and psychiatrists can help. Look for a provider who has experience working with people who are struggling to manage anxiety. We are glad you are taking the time to take care of yourself and hope this video was helpful. Please check out our other videos in the series, especially the ones on grounding techniques and sleep.